At the What Why Children in Hospital, we've been asking parents of children with learning disability about what they need to help them and their child when they're visiting the hospital or they have an appointment with the dentist or the optician. Of course, you know your child and you know what's best for them, but we do hope that you find it helpful to look at some of the experiences that parents have shared with us.
I think because my son has a learning disability, there's almost an assumption that he's not picking up on everything that's happening around about him because he doesn't always make eye contact with people. But Gregor is actually a very intuitive child. So if I'm worried and anxious before we go to hospital, it's absolutely certain that Gregor will be too.
With his autism and his learning disability, it's quite hard to judge. But I think the more he is told and he understands, and when that's supported with visuals and things, then the less anxious he is. We use social stories because it helps to reduce anxiety. Often you could tell a child with autism or a learning disability verbally, but they're not taking all that in often, and so it really helps them to focus with the pictures.
My daughter Melissa is 17 now. She has now been diagnosed as having a learning disability and is autistic. So I would like to be able to say to her, we're going here and this is what's going to happen and this is what it looks like. Of course I did a social story, but to have a visual element of real people in a real situation would have been so valuable.
I think the What Why Children in Hospital videos are a fantastic resource for parents to use for their children going to hospital. For my own son Gregor, he has very, very strong anxieties about hospitals and what might happen to him when he goes there. So I think if I was able to sit and watch those videos with him, talk him through what might happen to him when he goes, it would be a fantastic help for him for when it happens on the day.
Yeah, when we go to hospital, we tend to take a bag that we call Jack's Keep Him Happy bag, and we involve Jack in filling it with the things that obviously keep him happy.
In the past, when Gregor was younger, I didn't tell him about an appointment coming up. And it was about a year ago he said to me, "Mum, why did you keep that appointment a surprise?" That made me realise that that approach was no good for him anymore. So now what I do is I use his 3-week calendar and I put the appointment on. It climbs up from this week, next week and week after, so he can see the appointment coming up, and in that time we can talk about what's going to happen at the appointment.
When Jake was very small, if we had to go to a hospital appointment or a dental appointment, he'd get very, very upset and often have a huge meltdown because maybe he wouldn't understand why he was going there. So on one of these visits, when I was very upset and I think I just burst into tears and I was trying to chase him around the hospital because he just wouldn't sit still, a lady came up to me and said, "Can I help?" When I turned around, I realised that it was a nurse, and she explained that she was a learning disability nurse and that she was actually there to help with such a situation, to help Jake to understand why he was there and to support me as well.
So if Gregor's at hospital and he's going to have if anybody's going to meet him, it's very important that that person introduces themselves to Gregor, and then before they do anything, they tell him exactly what they're going to do, why they're going to do it, and ask him if it's okay for them to do it. And if the answer is no, then they have to not do it.
When Joe's got an optician's appointment, whether it's myself or his granddad who's taking him, the optician needs to come out and introduce himself to him. But also he likes a chance to touch some of the equipment before he'll settle into the chair. Also that if any lights are going to go on and off or any bits of equipment are going to be used, this has to be explained in advance so that he is comfortable to go forward with it.
It is much better if the doctor almost ignores me but interacts with Melissa directly, asks her questions, and Melissa will then refer to me.
A few weeks ago I had to take Tommy to the doctors because he was having an allergic reaction at school. I kind of had to say to her, I'm speaking for Tommy because he has autism, and in these situations he finds it difficult to speak. And once I had said that, her tone changed very rapidly, and she was actually very, very good with Tommy, and actually Tommy started to speak after that.
Well, one time when I think this was on Christmas Eve, when I had an anaphylactic shock, I had to go to hospital, and it's just really boring because I didn't have anything to do. And when I turned to one side of the bed, the hospital bed, there would be this really strange and horrid smell.
One of the problems when we're at the hospital or the dentist is the sounds and the smells. Even the noise of the other patients being called in, and that big door where patients go through and then they don't come back through the door again, is frightening to Melissa because she doesn't understand. I don't know what she thinks is happening.
Jack would find noise probably more of a sensory issue, especially if we're in a waiting room that is quite busy. We sometimes pack his headphones. He's also got ear defenders which can help him to keep him calm if it is a very busy environment.
Before we go to a hospital appointment, I always prepare Gregor in a very, very clear way and explain to him exactly what's going to happen. And over time, he's built an element of trust with me that that's all that's going to happen. So if we go to a hospital appointment and the consultant suddenly decides we might want to do something different today, like take some blood samples, I now would say to the consultant, I'm sorry, we can't do that today, but we will absolutely come back another day and do it when I've had time to get him ready for that procedure.
When I go to hospital these days, I'm much calmer because I'm feeling much more confident. I'm very clear on what will happen to my child, and I also know when to say stop. I work with the team, they work with me. I just need to be clear.